What's up, everybody? Jphelps here, and this will be my first official YouTube video with more to come in the future. And what the first YouTube video is about, which I will be explaining, is about my condition that I have called Pectus Excavatum. It's kind of funny, we're going surgery right off the bat, first video. And this will be a pre-op because I do have surgery this Friday for it. But I'd also like to give you a little bit of insight, of what Pectus Excavatum is beforehand for anyone who has it out there and are thinking about surgery. I'm going to bring you along and I'm going to tell you what you're going to expect during surgery and after surgery, the recovery time, the pain level, and everything like that. I'm going to make the videos into parts. Well, with my Pectus Excavatum, I started noticing it after I hit puberty. That's what usually people do because sometimes you won't be able to notice it beforehand. It'll just be a normal chest, but then it can start forming after puberty where the breastbone sinks in and this, the sternum kind of caves in right there. And it is very noticeable. It doesn't bother some people. Some people I know that have it are very, self-conscious about themselves. But the reason I'm getting the surgery is because I believe it could help you, later on in life with breathing, because that is a big thing about, the condition that people have. You'll notice that it's really hard breathing sometimes. I play sports, I play football, and I do notice that I get tired, quite quickly when I do it. And so what Pectus Excavatum is, like I explained, it's the breastbone sinked in. There's over 200,000 cases per year of Pectus Excavatum in the U.S. There's a 3-to-1 ratio with male to female, which is quite unknown. But females do get it, but it's mostly in males. It's really, really rare when you see it in females. And during the surgery, what they're going to do during the surgery is they're going to make 2 incision sites. One right here, and I think a little small one right here to put a camera in to make sure they're not going to puncture your heart. It's going to be totally safe. And when they put they're going to put a stainless steel bar in the middle, and they're going to use this, flipper thing, and they're going to flip it to cave out your chest, so it's looking normal again. And I think based on your height, weight, and how like I said, how your height, how tall you are, you could get 2 bars. I think I'm only getting 1, but some people do get 2 bars in them, and those will stay in there for about 1.5 to 2 years until it's fully recovered. But as well as one thing I would like to point out is not everybody likes the way when they get the bar taken out. It could cave back in. So basically, you're taking a chance, it could stay up. There's a lot of cases where it does stay up, but there is a lot of cases where it does sink back in. And yeah, so you got to be aware of that. The Holler index. Holler index is, kind of the diameter between your, spine and your ribs. And the Holler index usually, it increases when you have Pectus Excavatum. People with a 3.25 Holler index is kind of considered, very severe. I have a 3.9, which is, pretty much up there, so I qualify for surgery and, insurance as well, because it is a very expensive procedure. And I will show you guys right now about, what it looks like. All right, I'm back, guys. And here it is. You don't really notice too much, especially because it's on camera. You notice it way more in person. But if you look in the middle right here, it's kind of hard to see, but you can, kind of see the dent in your chest. It's more noticeable, like I mentioned, if you stand to the side, you can definitely see it. It's not normal. And, right there, you can notice it's really compacted on the heart, as you can see. So that's what they're getting fixed. They're gonna make an incision right here, 2 incisions, one for a camera and then one for the stainless steel bar, which they're gonna bring along here, kind of with a string, kind of a navigator, to over here. They are gonna have stabilizers at the end, which keep it in place because you don't want it displacing and hitting like a vital organ or anything. That would be really bad. And the hospital stay. You're going to be at the hospital after they do surgery for at least, I'd say, 3 to 5 days, depending on your condition, how severe it is, your height, weight, especially age. Age is a big one. the more older you are, the more pain you're probably going to feel, because your bones have stopped growing as fast, so they're not as flexible. So, but if young people, you're going to probably get it pretty good. Your bones are really flexible. It's best to do it at the young age. I'm doing it at 18. I just turned 18, and this is one of the best times to do it as well. So hopefully I don't get too much pain, but I know I will. I get a lot of pain at least. And they're going to place an IV kind of around your, right here on your forearm. And that's going to do, they're going to give you a button as well. You're going to be able to push that for, pain medication after it. You're going to be sitting in the recovery room, and you're going to want it to keep the pain at a low. And after your hospital stay, when you get home, you are going to be still in recovery. You can't do much. You can walk and everything like that. It's going to be the worst sleeping. I don't know where I'm going to sleep. Getting out of probably the bed is the worst, because it's going to be hard getting out of the bed. Probably sitting inclined, like on a chair or something like that, reclined. That would be the best option for you. If anyone has like a couch or, a recliner, that would be best. And yeah, so I think I covered it pretty much all, but I will be back, tomorrow with another video in the morning before my surgery. I'll be showing you around the hospital and all that. Just a little video. This is my pre-op though, like I mentioned, and I will show you my post-op. Week 1, day 1, I will show you everything, afterwards, the recovery time and everything like that in different parts of videos. But I thank you so much for watching, anyone who stayed to the end. This will not be my last video, and after the surgery stuff gets out of the way, I plan to do more with my channel. But right now, I thought I'd give a good introduction, because I'm having surgery, and anyone who needs help with this, I hope this helped. Getting surgery, but one more thing, actually, I didn't mention this. Only get the surgery if you want it. You're not going to want it, don't get the surgery if you don't want it. There'll be no point. You're going to want this. And that's another thing the doctors look for, if you want the surgery. I want the surgery. Some people don't. Some people are cool with it, and that's cool. But some people aren't. But thank you again. I will be back tomorrow with another video. Jphelps out.